Hello, my name is Michelle Stevenson. I'm a certified pediatric emergency nurse. I am graduating this fall from Excelsior College with a master's in nurse education. My capstone staff education project involved educating a group of emergency department nurses on the criteria, contents, and purpose of a developed education tool called a fever kit for families who present with febrile children to the emergency department. Once the group of nurses training was completed, those nurses were able to educate the rest of the interprofessional staff about the fever kits. Parents have numerous questions, apprehensions, and concerns when they have a febrile child. Often they do not know what temperature constitutes a fever, how to treat the fever, or even the correct dosages for antipyretics. Many parents have developed false fears about fever. Experiencing this fear leads parents to visit an already overloaded emergency department. Emergency department nurses are often the main educator for families with febrile children, and it is up to them to educate parents on the symptoms and the management of fever. Healthcare providers can also experience fears and have opinions of fever that are not evidence-based. A 2016 survey evaluated the views and practices of fever and pain management by health professionals. This survey asked the healthcare professionals what constitutes a fever, what antipyretics they prefer, and what are their side effects. Surprisingly, out of all the healthcare providers, the nurses scored the lowest with the correct answers. In order for the staff education project to be successful, the emergency department staff nurses' level of knowledge on fever and their fever education they supply families would need to be assessed. The 5 stakeholders for the project were parents of children with fever, Emergency Department Professional Development Committee, Emergency Department staff, the Emergency Department Director, and the Director of Nursing Education. Having consistent and reliable education at discharge can help the family feel confident that they can treat their child at home. According to Ismail et al. In 2016, misunderstood discharge instructions and diagnosis are often the main reasons for return visits to the emergency department. Parents need to be provided with the correct information about fever. Emergency department staff need to educate parents on comfort measures for their child with fever and offer parents guidelines on when to use medications and when to seek medical advice. The Emergency Department Professional Development Committee is made up of 6 staff nurses and 2 staff educators. Their main purpose and goals are to look for staff education needs and to look for opportunities to educate staff on the latest nursing practice. Each member of the Emergency Department Professional Development Committee was involved in designing, packaging, and implementing the fever kits. They also chose to participate in the project to ensure the interprofessional team was correctly educated on the distribution of the kits. Our pediatric emergency department is staffed by over 80 nurses, 20 ED techs, and close to 45 physicians, residents, and physician assistants. In order to educate the entire staff on the fever kits, a group of nurses were selected to be educated in order for them to educate the rest of the interprofessional team. In order for the project to be approved within the department, the director of the emergency department needed to be informed of the project's guidelines, content, location, and ask permission to use education hours for the staff's training. A literature review was completed on fever education and discharge instructions for families in the emergency department and presented to the director. According to the American Nurses Association's Code of Ethics in 2015, nurse executives and administrators must promote organizations' policies while developing a work environment that encourages evidence-based practice and professionalism. The hospital's Director of Nurse Education is responsible to review all educational material we supply to our families. She reviewed and approved the language, content, and also the images used for the fever information pamphlet. It is her responsibility to ensure the material is at reading level the parents can understand and is hospital-approved evidence-based practice. She attended the Professional Development Committee meetings and was very supportive and encouraging, providing excellent ideas towards the project. The Director of Nurse Education was also involved in having the pamphlet translated into Spanish for our Latino families. According to McIan and Wills in 2014, learning theories can help bring change in the way a person understands information or the way they perform a task or skill. As a nurse educator, it is important to know that using various theories for different situations and educational material can be used to enhance education for both the patients and staff members. Albert Bandera's social learning theory provides the best support for the Fever Kit staff education project. By having the staff nurses learn the material and then educate the interprofessional staff to educate the families exhibits Bandera's social learning theory, where people learn from each other and demonstrate what they learn by imitating and modeling. This technological tool is called a Voki and was used to introduce myself to the emergency department staff and to discuss the learning content of the project. Hello, my name is Michelle Stevenson. I'm a certified pediatric emergency nurse here at Children's National Medical Center. As part of a fever education initiative, our emergency department professional development committee has designed a fever kit to further educate our families. I had distributed instructions throughout the department via email and through visual education tools. There will be a pre and post test to evaluate further learning needs. If any questions, please contact me at extension 5203 or via the hospital email. I look forward to working and learning with you. Thank you. This is a video tool called Animoto and was used to educate the emergency department staff nurses on fever, fever management, and when parents should contact their physicians. This Powtoon video educates the staff on the reason, the content, and the distribution of the fever kits. A bulletin board located in the staff lounge is one way our department delivers education material for the whole interprofessional team. Everyone has access to it, and because it is located near the refrigerators, coffee machine, and microwaves, it is hard not to see when staff members take their breaks. Posters with the criteria, location, and instructions for the fever kits were placed in multiple areas where staff could read the information. The posters provided the instructions for distributing the fever kits and whom they should contact for questions. The 4 outcomes for the staff education project were: analyze the need for the parent education on fevers prior to the beginning of the project, design a fever kit education tool to distribute to families presenting to the emergency department with febrile children, function as a change agent throughout the educational program with the interprofessional team, and facilitate learning for emergency department nurses about the fever kit, the purpose, inclusion criteria, distribution plan, and how the emergency department and families will benefit. An online evaluation tool was used to test the staff nurses prior to and after the education. It's been reported using pre- and post-test questionnaires can evaluate emergency department nurses' knowledge regarding practice and attitude towards patients' education. As a leader, change agent, and a member of the interprofessional team, it is important to assess the learning needs of the group, to look for changes and improvements that may be addressed during the project, and to encourage input from others on the team. Communication is key when interacting with others working on the project. Informing them of the process, including them in implementation, and notifying them of changes as they occur will help in the success of the project. The first question asked was if the nursing staff supplies a thermometer to the families who state they did not have one. There was a 3% increase in the number of nurses who always, and a 3% increase in the number of nurses who sometimes supply families with a thermometer. Question number 2 asked if the nursing staff educate and demonstrate taking a temperature when they distribute thermometers to the families. There was a 67% increase in the number of nurses who said they always provide education with the thermometer distribution. The third question asked the nursing staff if they provide medication syringes along with demonstration. 100% of the nurses in the pretest answered they sometimes present demonstration to the family. The post-test showed 33% of the nurses now always give a demonstration when they supply families with medication syringes. Question number 4 asked if the nurses tell families fever will continue after they are discharged from the emergency department. There was a 3% decrease in both the amount of nurses who stated they always or sometimes tell families fever will continue. The last question asked if the nursing staff felt their fever education helped eliminate fever bounce-backs to the emergency department. There was a 47% increase in the number of nurses who felt their fever education helped families not return to the emergency department. The purpose of this project was to educate a group of staff nurses in the emergency department on discharge fever education and the use of fever kits in order to educate the rest of the interprofessional staff. Once all the staff was educated, the fever education could then be distributed to the families in the emergency department. Because of the different schedules for the staff and the nature of the emergency department's environment, educational videos were used to train at the staff's leisure. All 8 staff nurses completed their education. Post-test results showed improved education, but there was a need to further educate the staff on fever control. As challenging as it was to teach such a large group of individuals, educating a small group of nurses in order to educate the interprofessional staff proved to be an efficient way to accomplish the task. Thank you.